Welcome to the Peer Advocate Mental Health and Seniors Law Empowerment Model. Module 1 is really about empowering communities to make life safe within mental health settings. It's based on the experiences of Seni, who actually died in 2010 after being restrained by the police. During this training session, which is the first of 3 modules, specifically geared towards the experience of African Caribbean communities, you will learn about the definition of the Use of Forces Act, historically how it's been used in the past, and how we can empower communities to ensure that we are safe in settings that traditionally have led to the demise of black communities. Module 1 is really looking at some very basic outcomes, the historical context of use of force, the case study of Seni, some of the definitions that are really important to people to understand, and also your human rights when you are stopped by the police and taken to a mental health unit. So this workshop can be used in terms of a face-to-face or online. It looks at the historical context, the definition. There will be a video for you to watch and also to begin to look at your values and experiences about what change are needed to ensure there's true equality, and there will be a review at the end. We start off by saying learning is very important. Learning in groups is that mean you should be finding out does your name mean as an African within English society? What choices do you have? What do you want to learn? And we use the work of W.G. Du Bois about the colour line, about how we can understand the complexities of our own life stories and lived experiences. Within this workshop, you can be working in groups or on your own, but we want it to be a mixed group of learning from lived experience, gender, race, practitioners coming together, looking at issues around seclusion and segregation. How can we change the language so it's more lived experience to the cultural realities of the African community? We start off by saying there's an historical context of use of force, and that is not in the guidance. This has been used over 400 periods in the period of slavery. But we'll begin to look at how that definition has become more medicalized to the European definitions about how you control the black body in a mental health setting. So let's begin to be really clear about what we're talking about. Constraint or restriction is actually controlling the body, whether physically, mechanically, or through acts of isolation and seclusion. They're all forms of restraints. Medication is probably the biggest one, which we'll be delving into in Module 2. To make people very clear that the Mental Health Use of Forces Act that came into operation in 2018 breaks down the definition in terms of where it can apply: acute mental health wards, long-stayed wards, forensic inpatients, and it applies to groups of people who have autism and learning disability. It should not, and it does not cover Section 135 and 136 suites. We use very important pictures. The last picture you saw, Sean Riggs. This picture you see Dalen Atkinson, the first black person who was actually died through manslaughter through restraint. And we show people very vivid pictures of what restraint actually means. We got the chemical, the physical, mechanical, and the taser. But it's really important that people understand that restraint is used in relation to mental health patients. And this is where people actually suffer from what they call a mental disorder. Also, there's a challenge about people should have capacity to make decisions. So it's a quick interactive workshops. We will give you the guidance, but some people learn from watching films and watching YouTubes, and we'll give you more detail about how this definition is broken down. We would ask you to watch the film of 20 minutes. It's painful, it's difficult, but to write down how do you actually feel about this case, how black men and black communities, children with autism, learning disabilities are being treated under the Mental Health Act restraints. The exercise for people who may be doing this on their own or in groups or online is to read the case study. Look at what the police did. Listen to what's being said. Ask some really serious questions. If Seni was white, would it have been different? Produce some cards of what you consider to be good practice and put them in an order of Diamond 9 so you can inform a more equitable race-informed practice to culture and restraints. But it's really important in this first session that you, as we give you your rights, that you know you have rights under human rights legislation of 1998. That you have rights under the Mental Capacity Bill 2005. There is a code of practice which we will send out to you about how practices should act in looking after you in terms of your mental health. And also they should know there are principles that they should be using when they look at and work with African communities. And also the principles of the Mental Health Act are paramount and very important and should operate as good practice. So once you begin to do the training, check out what you've learned in this first session. Do you really know what a mental disorder means in terms of the disease of the body? Do you know when the legislation came in? But also, you need to do some reading, and the book we actually advise people to read is Black Skin, White Mars by Frantz Fanon. And begin to understand, if you get a copy of the guidance, the movement towards informed trauma as an essential part of the protection and safeguarding and duty of care to African communities in mental health units. Thank you for taking part in this first session, which is attached to our consultation with black service users and a report that's recently been sent into the Department of Health and Social Care. If you read that report, you will see Module 2 and Module 3. Can I thank you very much for your time?